Imagine waking up in the dead of night, heart pounding, dizzy, and gasping for air, not from a nightmare, but from a silent stroke triggered by the healthy snack you ate just hours before. For seniors over 60, this isn't just a scare, it's a real risk hiding in your pantry, and it's time to uncover the truth before it's too late. As we age, maintaining health becomes a priority, but certain habits and medical practices can pose unexpected risks, particularly for those over 60. This guide explores the hidden dangers in common, nighttime snacks and routine medical tests that may increase stroke risk in seniors, offering practical, science-backed alternatives to promote heart and brain health. Nighttime snacks to avoid for better senior health. Many seniors enjoy a handful of nuts or trail mix before bed, believing these are healthy choices. However, certain snacks can silently elevate stroke risk by affecting blood pressure, inflammation, and blood clotting, especially when consumed at night when metabolism slows. Pecans. Why they're risky. Pecans are high in saturated fats and calories, over 200 calories per small handful. At night, slower metabolism means these fats linger in the bloodstream, increasing blood viscosity and clot risk. Health impact. A study from the American Journal of Clinical Nutrition shows that high saturated fat intake late in the day thickens blood, slowing flow and raising stroke risk in older adults. Safer choice. Enjoy pecans in the morning with oatmeal or a smoothie, to allow your body to process fats during active hours. Pine nuts. Why they're risky. Pine nuts are rich in omega-6 fatty acids, which, without enough omega-3 promote vascular inflammation. Chronic inflammation weakens arteries, increasing stroke risk. Health impact. The Journal of Lipid Research links high omega-6 diets to vascular inflammation. It's particularly dangerous for seniors with fragile arteries. Safer choice. Use pine nuts sparingly earlier in the day, paired with omega-3 rich foods like flax seeds or fish. Hazelnuts. Why they're risky. High in arginine, hazelnuts boost nitric oxide, causing blood vessels to relax. In seniors with fragile vascular systems, this can lead to unstable blood pressure or capillary rupture at night. Health impact. Hypertension. Research notes that excessive vasodilation in seniors during rest can cause microvascular complications. Safer choice. Consume hazelnuts in the morning and consult a doctor if you have hypertension or vascular issues. Trail mix. Why they're risky. Store-bought trail mixes often contain high sodium and sugar, leading to fluid retention, increased blood pressure, and vascular inflammation. Health impact. A circulation study found that high sodium and sugar intake at night increases vascular stiffness and clot risk. Safer choice. Make homemade trail mix with unsalted nuts and unsweetened dried fruits and eat it earlier in the day. Salted roasted almonds. Why they're risky. High sodium content, 150 to 200 milligrams per ounce, causes fluid retention, raising blood pressure and stressing the cardiovascular system during sleep. Health impact. The Journal of Clinical Hypertension links nighttime sodium intake to elevate a blood pressure and higher stroke risk. Safer choice. Choose unsalted almonds and eat them during the day to minimize cardiovascular strain. Pistachios. Why they're risky. Like hazelnuts, pistachios are high in arginine, causing unpredictable blood vessel relaxation at night. Salted varieties add sodium-related risks. Health impact. The American Journal of Physiology suggests nighttime nitric oxide spikes can disrupt blood pressure regulation in seniors. Safer choice. Opt for unsalted pistachios as a daytime snack. Walnuts. Why they're risky. Walnuts are rich in omega-3 but also high in fats that linger in the bloodstream at night, raising triglyceride levels. Some seniors may experience acid reflux, disrupting sleep and increasing cortisol. Health impact. The European Journal of Clinical Nutrition found that high-fat foods before bed elevate nocturnal triglycerides, linked to arterial stiffness. Safer choice. Eat walnuts with breakfast or lunch to leverage their benefits without nighttime risks. Timing matters. Enjoy nuts earlier in the day. Choose unsalted versions, and pair them with omega-3-rich foods to support heart and brain health without increasing stroke risk. Medical tests with hidden stroke risks for seniors. Routine medical tests are crucial for early detection, but some carry risks for seniors, particularly those with high blood pressure, heart conditions, or kidney issues. Below are 5 common tests that may pose stroke risks and how to approach them safely. CT scan with contrast. Why? It's risky. Contrast dye can trigger blood pressure spikes or drops, stressing fragile vessels. Seniors with hypertension or kidney issues are especially vulnerable. Health impact. The Journal of Vascular and Interventional Radiology found higher vascular complications in seniors. Post-contrast CT scans. Safer approach. Ask if the scan is essential or if a non-contrast CT or ultrasound can suffice. Share your medical history, including kidney or heart conditions. Exercise stress test. Why? It's risky. Walking or jogging on a treadmill increases heart rate and blood pressure, potentially causing arrhythmias or vessel tears in seniors with vascular issues. Health impact. A 2020 American Journal of Cardiology study reported a 7% rate of harmful events in seniors during stress tests. Safer approach. Inquire about alternatives like nuclear stress tests or resting echocardiograms, especially if you're asymptomatic. Endoscopy with sedation. Why? It's risky. Sedation can alter blood pressure and circulation, especially in seniors on blood thinners, increasing the risk of internal bleeding or stroke. Health impact. A 2021 gastrointestinal endoscopy review noted increased transient ischemic attacks in seniors post-sedated endoscopy. Safer approach. Confirm the necessity of the procedure and discuss non-sedated options or medication adjustments with your doctor. MRI with contrast. Why? It's risky. Gadolinium-based contrast dye can linger in seniors with reduced kidney function, potentially causing neurological symptoms or nephrogenic systemic fibrosis. Health impact. A 2019 radiology study linked contrast. Is 2 stroke-like symptoms in 5% of seniors within a week. Safer approach. Request a kidney function test (GFR) before the scan and ask if contrast is necessary or if a non-contrast MRI is viable. Carotid artery ultrasound. Why? It's risky. Routine scans in asymptomatic seniors may detect minor narrowing, leading to unnecessary surgeries with stroke risks. Health impact. The New England Journal of Medicine found that surgery for moderate asymptomatic carotid narrowing often offers no benefit over medication. Safer approach. Ask why the scan is needed and whether lifestyle changes or medication can suffice. Seek a second opinion before surgery. Protecting your health after 60 means making informed choices about what you eat and the medical tests you undergo. By avoiding certain nighttime snacks like pecans, pine nuts, hazelnuts, trail mix, salted almonds, pistachios, and walnuts, and opting for daytime consumption, you can reduce stroke risk. Similarly, approach medical tests with caution, asking questions to ensure they're necessary and safe for your condition. Subscribe to Health 365 for weekly tips to stay strong, safe, and vibrant in your golden years.